Topic is Marfan syndrome. Marfan syndrome is an autosomal dominant genetic disorder that affects the connective tissues and causes weakness. As an autosomal dominant genetic disorder, only one parent must carry this abnormal gene to pass it on to their offspring. Marfan syndrome most significantly affects three body systems: skeletal, cardiovascular, and ocular. So let's discuss some of these clinical features of Marfan syndrome. As you can see in our illustration to the right, these clients will be extremely tall and slender. You'll see that they have long arms, legs, and fingers. Just think of Marfan, their arm is fanning out very long. They'll have joint hypermobility, so they'll have looser joints and be double jointed. Clients can also have scoliosis or kyphosis. As you can see in the illustration, we can have that humpback presentation, which is indicative of kyphosis. And pectus excavatum. This is where the sternum bone is pressed inward. So think of excavatum is causing a concave presentation, so the chest is caving in. The cardiovascular system can be affected. Remember, this disorder causes weakness. So we're going to have a weakened and dilated aorta, as well as weakened and leaky heart valves. The eyes can also be affected due to this weakness, so clients can have decreased visual acuity or even visual disturbances, such as myopia, which is nearsightedness. In this illustration, you can see an example of the length and hyperextension of the arms. So clients with Marfan syndrome are able to put their hands behind their back and meet their palms together. If you try to do that at home, you probably won't be able to. Arachnodactyly, or long fingers. This can present in two different ways. So as you can see in the illustration to the left, this is a thumb sign. So when you overlap your fingers over the thumb, ours won't show. But in Marfan syndrome, the fingers are so long, the thumb will extend past those overlapping fingers. On the image in the right, you can see that whenever the client with Marfan syndrome goes to encircle their wrist with their middle finger and thumb, their fingers will actually overlap. Unlike with us, our fingers will just meet or not meet at all. So let's discuss some of the complications associated with Marfan syndrome. Remember, this is all due to weakness, so keep that in mind as we discuss these issues. Clients can have a dislocated lens, as you can see in the image to the right. This is due to weakness of the structures holding the lens in place, and when they become too weak, the lens will then change position and move to the anterior chamber of the eye. Clients can also have retinal detachment. This is an emergency and can cause a complete loss of vision. The cardiovascular structures can be affected. We can have this weak, dilated aorta, known as an aortic aneurysm. We can also have valve regurgitation, which is due to the weakened valves in the heart that won't close completely, and this causes backflow of the blood. We can also have tears in the cardiac vessels. Specifically, we can have an aortic dissection or rupture, which is a life-threatening emergency. Clients may also have mitral valve prolapse, which again is a weakening of that mitral valve. Women with Marfan syndrome are uniquely affected, as they are at high risk of mortality during birth if they were to get pregnant. Let's discuss nursing interventions for clients with Marfan syndrome. We need to educate them to get regular eye exams to ensure that they're not having any signs or symptoms of some of those weakened structures, such as dislocated lens or even the emergency of the retinal detachment. Cardiac monitoring needs to occur so that we can hopefully prevent or catch any of these weakened vessels early and monitor them. Reliable contraception is extremely important for these women with Marfan syndrome so we can decrease their risk of pregnancy and therefore decrease risk of mortality. We also need to monitor spinal curvature. This is most significant with our adolescents who are growing at the most rapid rate. This is when the spine can change shape or curve the most. So clients should also be reporting back pain, as this could be an early sign of scoliosis or even kyphosis. This is extremely important. Clients with Marfan syndrome need to avoid any high intensity or contact sports, and this is to prevent those life-threatening complications such as aortic dissection. So clients need to avoid any quick burst activities such as sprinting or even weightlifting activities. Clients may also be prescribed medications by their healthcare provider in order to decrease the heart rate and decrease aortic stress or the cardiac load. An example of these medications are beta blockers.